Welcome back to the show. I'm Dr. Nate Bergman, and it's good to be back with you. And you might notice we're in video, right? If you're watching, if you're not just listening, there's been a number of requests for video. So we're going to try some video and see how that goes. I just want to share about a month ago or so on my kind of usual automated feeds, I saw an article where the title was Alzheimer's might not actually be a brain disease, expert says. The article was written by Donald Weaver. He's a professor of chemistry and a director of a research institute at the University of Toronto, well-known institute. The article was originally published in an online publication called The Conversation, which kind of prides itself on academic rigor. And even though they've taken sort of some journalistic flair with the title's obviously meant to be get your attention. Still, we can kind of presume that this is at least as reputable a source as anywhere else. So the crux of the thing here is that again, many of you might have heard about this. Over the summer, one of the kind of sacred truths in Alzheimer's has been called into question. There's a big controversy around the idea that amyloid beta, which is a toxic protein that accumulates and builds up between brain cells in Alzheimer's, whether or not that really is primary cause of Alzheimer's, right? For decades now, most of the research has had to be in kind of an amyloid space. The drug research, basic research, government-sponsored research has really been around the amyloid hypothesis. And because of some potential inaccuracies in this 2006 article from the University of Minnesota, upon which many of the later studies were kind of built, there has been in the last several months an opportunity for some of the so-called alternative hypotheses, and they are academic hypotheses for the most part. Some of these alternative hypotheses for what might cause or give rise to Alzheimer's that come out of the wings, where they've been waiting largely, and I think rightly so in my opinion, for research dollars. So I actually want to read to you from this article so you can see how Dr. Weaver is conceptualizing this. And then I want to share with you a little story from one of my patients where how kind of this applies. Right? So again, we're reading from the Conversation, the articles from Conversation by Donald Weaver, September 20th is the date. And I'm quoting here, and I'll editorialize a little bit just to make sure everybody's tracking and understanding what he's saying here. But he says, quote, when brain trauma occurs, or when bacteria are present in the brain, beta amyloid, again, that's that toxic protein, beta amyloid is a key contributor to the brain's comprehensive immune response. And this is where the problem begins. Because of striking similarities between the fat molecules that make up both the membrane of the bacteria and the membrane of brain cells, beta amyloid cannot tell the difference between invading bacteria and host, like the brain's own host brain cells. So it mistakenly attacks the very brain cells it's supposed to be protecting, right? So because of the surface, it's almost like the skin of the bacteria and the skin of the brain cells look very similar. So our own immune systems get confused. And so we continue with the article. This leads to a chronic, progressive loss of brain cell function, which ultimately culminates in dementia, all because our body's immune systems cannot differentiate between bacteria and brain cells. So when regarded as a misdirected attack by the brain's immune system on the very organ it's supposed to be defending, Alzheimer's disease emerges as an autoimmune disease, right? And an autoimmune disease is literally a condition in which the brain or the body and the immune system is attacking itself because it's confused, like Weaver's laid out here. He continues on. He says, there are many types of autoimmune diseases, such as rheumatoid arthritis, in which autoantibodies, those are proteins that our own bodies make against ourselves, play a crucial role in the development of disease, for which steroids, so prednisone, think prednisone, Medrol dose packs, so that's these autoimmune diseases for which steroid-based therapies can be effective. And then he says something critical, but these therapies will not work against Alzheimer's disease. Why that is a different topic. It says, though drugs conventionally used in the treatment of autoimmune diseases may not work against Alzheimer's, we strongly believe that targeting other immune regulating pathways in the brain will lead us to new and effective treatment approaches for the disease. So that's the end of the article. Really interesting, right? So it's focusing on, well, is Alzheimer's a brain disease? Sure, it's a brain disease, but it may not, in all cases and in all mechanisms, boil down to just this amyloid beta response. And if you're familiar with the work of Dale Bredesen and others, many people are arguing, okay, maybe we have to look at the mitochondria. We have to look at toxic effects. We have to look at head injuries. We have to look at blood vessel health. We have to look at blood sugar health. We have to look at hormone health. So there are so many contributors that are potential here. And Weaver here is, I think, I don't want to say oversimplifying it, but there's this tendency to sort of reduce the cause of a disease to one thing. But he makes his point is really good in the sense that he's bringing up a very important point about the possibility of immune dysfunction or autoimmunity in cases of Alzheimer's. And I'll share with you a story of one of my patients who's active with us now. I'll change name, date, all the details about him are changed, but it's a guy who has been experiencing cognitive impairment since his kind of mid 50s. We saw him in his early 60s, so before 65, and he had already received a diagnosis of early onset Alzheimer's disease. He had seen a conscientious academic neurologist. He had MRI, neuropsychologic testing, and he also had a lumbar puncture, a spinal tap, right, which kind of looks at a bunch of markers to see if there's an autoimmune reason or some other reason that someone might be getting sick. And his work, the kind of work he did, had required him over 3 decades or so to be really exposed to several kinds of environmental chemicals and toxins. We now know that environmental toxins, air pollution are at least a fifth of the cases of Alzheimer's disease. It's implicated in Parkinson's disease. It's probably a contributor to Lou Gehrig's, ALS, et cetera, right? So neurodegenerative disease is at least in part associated with exposure to environmental chemicals and environmental toxicants. So this guy has an abnormal finding on one of his spinal tap numbers that are looking for autoimmune encephalitis. So inflammation in the brain that might be a result of this body attacking itself. And he had very clearly something that was abnormal. And he was treated for 6 weeks with steroids with no response. And then was just sort of, okay, that's it. You have Alzheimer's, because his other proteins in his spinal tap were consistent with the so-called signature of Alzheimer's. So he had an Alzheimer's. But again, there are different kinds of Alzheimer's. One person's of Alzheimer's is not the same as another person's Alzheimer's. It seems that, at least in our experience, follows with the evidence that there can be multiple causes or drivers, and they have to be identified and dealt with one by one. So no one really pushed here for any other treatment. He was just kind of, like most people we see, kind of dangled out, say, okay, well, there's nothing we can do. You have Alzheimer's, take medication like Aricept and Episil, which doesn't really fundamentally change anything. And I kind of like the whole prepare to die thing. And it took us a few hours just to go through all his records and results. And, these are big, intense appointments. But we found this, and we had then to say, okay, what about other kinds of immunotherapy, particularly IVIG? IVIG is an immune replacement therapy. It's intravenous immunoglobulins. We did an Evolving Past Alzheimer's podcast episode with one of the world leaders in this, Dr Merce Boada. She's in Spain a few months ago. You can just listen to the first 5-10 minutes of that if you want kind of the lowdown with some of the plasma replacement therapy and the IVIG that she's doing. But she's seen cases where people's cognitive impairment slowing down. In some cases, it's improving, right? Especially if you get this earlier on. So anyways, with this gentleman, we had to kind of really search regionally, send him to a rheumatologist, so kind of a specialist in autoimmune conditions, to see if she would qualify him for IVIG, which she did. He responded. And then was interesting. He had some response to dietary strategies. He had, some response to some of the supplements that he was using. But this IVIG, which he was getting at first every 4 weeks, really, according to his wife, it really kept his brain kind of glued together. In fact, IVIG, you can control the dose. You can also control how often you give this. It's fairly expensive. Insurance is going to cover it if there's, if there's a clear indication for it. You got to go and get an IV, and you got to get an infusion once a month. This man's now getting it every 3 weeks, because what was happening is that when he was only getting it for 1 month, it would run out. And again, he's still trying to work, and it would kind of run out, and he would have much more cognitive impairment for that sort of week. That is, he didn't have a reinfusion of IVIG. So we've had to sort of tighten up, or recommend that he's tightened up his IVIG infusions, and also have to raise the dose. And it's amazing to hear how much it helps him, right? And he's not the only one. So I think it just really brings up, I think my final point here is that this brings up this huge point about analyzing and treating the immune system. Alzheimer's is not the same for everybody. It's not easy necessarily. It's not straightforward. Sometimes it does require a spinal tap or a lumbar puncture. But in my opinion, in cases where these things have not been fleshed out and we're suspecting it, we got to go after it. So that's my little bit here. I hope you enjoyed the video aspect of this. Maybe we'll have some more. Leave comments, questions if you have them. I'm Nate Bergman, and thank you so much for listening. We'll talk again soon.